guys, in today's video I thought it would be fun to share with you an update on my experience with the iRestore Professional Hair Regrowth System. I purchased this in January of 2019, and since then I've been using it every other day for 25 minutes. And I have had great success with this hair regrowth system. Specifically, I have noticed an increase in my hair strength, quite a bit actually. Less hair breakage, just stronger hair overall. And I've noticed an increase in hair thickness. Specifically, my ponytail is a lot thicker than it once was. I can tell because when I put my fingers around my ponytail, I now have a thicker ponytail. But yeah, so I get a lot of questions about this, and I thought I would delve into some of the most frequently asked questions and kind of share with you my personal experience using it. I do recommend this device to my patients who have androgenetic alopecia, whether they be men or women. Works for both types of pattern hair loss. And honestly, you guys, pattern hair loss or androgenetic alopecia, it's one of the most common forms of hair loss. It affects 8 million Americans. It's very distressing and it's a chronic issue. There's no real cure for it beyond a hair transplant. And many patients are seeking an at-home hair regrowth system, and the iRestore really delivers. And I feel very confident in this device. It is FDA cleared, and what that means is that it's been shown to be safe and effective. That is one of the most important things when choosing an at-home hair regrowth system. I often find myself doing this at nighttime, like when I edit YouTube videos or I'm wrapping up on some clinical work. It's really easy. It just takes 25 minutes and it's super comfortable to wear. I'll show you guys. I'm gonna do my session here for you. Now, oftentimes I will part my hair in the middle, but honestly it doesn't really matter. You can just put it on your head. The lasers and LEDs within the helmet will reach your scalp regardless of the position of your hair. You want to make sure that it's plugged in, and then here's the little, I don't know what you call a switch. So to get it started, just make sure that it's on comfortably. Anyways, to get started, you just want to, of course, be seated in a comfortable position. And you can see the lights are going. You can see the lights are going, and it has a little countdown of the number of minutes left. And then if you want to pause it, you certainly can. To do so, you just hit the stop button and you'll hear a short beep, and you can pause it for 5 minutes. Now, if you don't resume after 5 minutes, it will automatically shut off. And to resume, you just want to hit that button again. And at the end of the session, it will beep. You'll hear a long beep, and then it'll just turn off automatically. And the cord is long enough that you can walk around with it. One thing I don't like about it though is that if you have hair loss on the occipital scalp, which is basically down here, it's not gonna get that area. It's really ideal for the crown and the parietal scalp or the sides of the scalp. But if you have a lot of hair loss on that occipital area, you're gonna have, you're not gonna get the light energy to those areas. But it does offer a really good distribution of the light energy. Now, the light energy that's delivered to your scalp is non-thermal. It's not heating up your scalp or anything. However, the delivery of the energy, part of how it works is it stimulates the production of nitric oxide, which results in vasodilation. That's going to bring in growth factors to nourish your hair follicles. So it's not unusual to experience a warming sensation, but I want to be clear, it's not because the light energy is heating up your scalp. It's really just that you're getting an increase in circulation to the scalp, and that's part of how it works. The iRestore Professional uses a combination of low power lasers and LEDs to deliver light energy, specifically red light or near infrared light, to the scalp. Now, these wavelengths have been shown in clinical trials to result in biochemical alterations that treat pain, reduce inflammation, and later there was a great interest in seeing how these effects might help the hair and hair regrowth when applied to the scalp. And we know that the administration of low-level laser therapy to the scalp results in increased hair thickness, and a lot of how that is thought to occur is through these biochemical alterations that support cell renewal and ultimately hair regrowth, along with increasing blood flow and circulation and bringing in growth factors. Clinical trials demonstrate efficacy in hair regrowth in individuals who are suffering from pattern hair loss when using low-level laser therapy. So it is a great treatment modality. It can be used by itself for people who have been, kind of frustrated with traditional hair regrowth treatments like Rogaine or finasteride, or in the case of women, spironolactone. However, it also can be used alongside those treatments, and arguably, when used alongside those treatments, you will get even better results. And you may be wondering, where does low-level laser therapy fit into a hair transplant? The hair transplant surgeons will tell you that low-level laser therapy enhances the success of the hair transplant. So it's also a good option if you are already pursuing or thinking about pursuing a hair transplant. This is a good adjuvant treatment to consider adding on or to discuss with your healthcare provider. It's safe for people ages 18 and older. We don't know about how it would work or its safety in people younger than 18. So discuss with your healthcare provider if you are under the age of 18, if this is something that is going to be right for you. But research suggests that low-level laser therapy, when applied to the scalp, stimulates follicles, supports cell renewal and ultimately hair growth, and increases the energy within the scalp through the molecule ATP, which is the energy snack of cells. So you can see at this point I've got 16 minutes left. But it's really comfortable at this point. I honestly don't feel anything. I typically forget I even have this thing on my head. It's a good thing it shuts off automatically. What about some of the other devices on the market? In 2007, due to the demand for an at-home low-level laser therapy device from patients, in 2007, the FDA approved the HairMax laser comb. And studies show that that device did in fact result in improved hair density and thickness in patients with pattern hair loss. However, two issues arose. Patients found that they kind of bailed on it after a while. A lot of patients were not happy with it. And it seems as though because the comb, the nature of the comb is such that it's really hard to get uniform distribution of the light energy. So to solve that issue, companies like iRestore came out with helmets that would allow for a more even distribution. And so they've significantly improved upon the technology that was originally in the HairMax laser comb. They've improved that technology quite a bit, so you get a better device basically. As with any hair loss treatment, it requires patience. You're not going to put this on, sit there for 25 minutes, and then wake up with Rapunzel hair. It takes time to start seeing results. You can start seeing results in as little as 12 weeks, but I would say realistically 24 weeks is when you will begin to perhaps notice hair regrowth. What you might expect with this device, as with any hair loss treatment, is that in the first few months you actually will have an increase in hair shedding. However, that's to be expected. The reason that occurs is that as the energy is increasing blood flow and delivering those growth factors, what ends up happening is that hairs that are going to be shed, they're kind of kicked out to make room for hair regrowth. It's normal to shed about 100 hairs a day. So when you first start using a hair treatment device, or really any hair treatment, those hairs that are expected to be shed, they're kind of all gonna get kicked out at once. So don't be alarmed by that, it's perfectly normal. So in the first 3 months, you have some shedding. You won't notice though, it's not as though that shedding though does not turn into bald patches. So you're not gonna have an exacerbation of baldness or thinning in the sense of seeing more of your scalp. You're just gonna have more shedding as those healthy follicles are being stimulated and regrowth is getting kicked off. It just takes time. Then around 3 to 4 months, you will still have some shedding, but you're gonna start observing some fine downy baby hairs. And then by 5 to 6 months, you're really gonna start appreciating increased hair thickness, fuller hair, and increased hair growth and hair regrowth. And that's really when you'll start seeing results. I would say that's reasonable to expect. Now for me personally, I did notice some shedding in the first few months, but probably around 4 to 5 months, I really was like, wow, my hair seems to be growing a lot faster than it typically does. And that's really when I began to appreciate subtle increases in thickness. And that increase in thickness continued, and it's kind of plateaued at this point. Like, it's not like my hair is not growing and growing and growing and getting thicker and thicker and thicker. It does plateau, but I have enjoyed using this, and I've continued to use it and have maintained that increased thickness using the device. One of the things people want to know the most though is what happens when you stop using it. Do you lose all of your hair? What can you expect? No, you stop using it, say you just get bored of using it, or you go on vacation, you don't want to take it with you, although it's pretty easy to take with you. Or say you just go through a period of time where you're just not keeping up with it. Do you suddenly go bald overnight? Absolutely not. But what will happen is that because you're basically removing the scalp health aspect of the light energy, then you will lose that extra bit of support in your hair regrowth journey. And so depending on what other treatment modalities you're using, your hair loss will continue and ensue. So to be clear, this is not a cure for pattern hair loss, but it will support regrowth of the hair. And it's not going to cure your genetics or anything like that. But say you're using minoxidil and you're using this and you're getting good results, you've been using this, you're 6 months in, and then say you kind of start slacking on this, but you're still using the minoxidil, you're not going to see an increase in shedding with that. But say you stop both, then you're definitely going to get some shedding with time. And if you have your pattern hair loss will move along as it would ordinarily. But it's not like you stop this and everything that was being supported and regrowing suddenly falls out all at once. But those follicles now are no longer supported, and your background disease process is going to creep on into those hair follicles, and they will miniaturize with time. I get questions all the time though about this device, like, can I recommend a less expensive one? No. There are many factors that went into me deciding on this device and why I recommend it. First of all, I like the helmet technology. A lot of the less expensive devices on the market are combs, or like there's one that looks like a hairband. They just don't give even distribution of the light energy. Second reason that I like it so much is that it's FDA cleared, which basically means that it has been shown to be safe and effective. And so that's an absolute must, but that's not unique to this device. Many are FDA cleared. That's definitely something you want to look for. But the other thing that I really like about this device is that they have a great money back guarantee. And I know that sounds like a little bit like an infomercial, but in the case of this, I think it makes all the difference. If you don't see results after a year, they will give you all of your money back, and they don't charge you to send it back to them. Many of the other low-level laser therapy devices on the market, if you're not happy with them, they'll give you your money back, but then they make you pay for like sending it back, which I think is a racket. iRestore has a 12-month money-back guarantee. You're gonna know about 6 to 7 months in if this is working for you or not. And if it's not, then it's really easy to return this, get your money back, and that's it. Honestly, truthfully, not everybody is gonna see results with this. And that is why I love iRestore, because they acknowledge that up front by having this money-back guarantee, is that not everyone's gonna be happy with this device. It's not gonna get everybody the type of hair regrowth that they're looking for. They're not gonna see the kind of results that they want. They're not gonna be happy with it. That's the truth of any hair loss treatment. Rogaine, spironolactone, finasteride, low-level laser therapy, all of them. There's no treatment that 100% of users are satisfied with. And so they acknowledge that up front with their long-standing money-back guarantee, 12 months. I mean, you should know at 6 to 7 months, but 12 is even better. I really did a lot of research before deciding on buying this. I'm sure there are some other helmets out on the market now, but at the time, this was the one that stood out for me, and I've been using it for, like I said, over a year now, and I've really been happy with it. I also get a ton of questions about this device for different types of hair loss beyond androgenetic alopecia or pattern hair loss. I will say this, if you have hair loss, the most important thing, you have to do this actually. I mean, it's imperative before considering buying a device like this. You have to see a dermatologist and get a diagnosis of your hair loss. I'm a dermatologist and I can tell you guys, there are many forms of hair loss that this will do nothing for, and you'd be wasting your money. And so you really need an accurate diagnosis. A lot of times that involves blood work and a scalp biopsy to truly know what disease process is going on. And then, depending on your diagnosis, have a candid conversation with your dermatologist about low-level laser therapy. The data is strongest and most robust for pattern hair loss. There are so many other forms of hair loss though that we don't have studies on low-level laser therapy for, so it'd be really hard to say, yeah, go for it, especially with a device like this that's not cheap. In the long run, I think it's a good investment if you have pattern hair loss, but if you have some of these other forms of hair loss, it may not be right for you. For example, a very common form of hair loss is called telogen effluvium. It's basically a lot of hair shedding that happens 3 months after a stressful event, like a fever. So long as that stressful event is not a recurring issue, and honestly a fever should not be, although of course there are diseases in which you do have chronic fevers, but anyways, I digress. Say you had a fever, 3 months later you develop a telogen effluvium. It's distressing, it's not pleasant to go through. Do you need to invest $1,000 in a low-level laser therapy device to correct that? Absolutely not. So long as you're not having ongoing fever, you know, the hair will eventually regrow. And I would say don't waste your money on a hair regrowth system. That being said, it would not surprise me if you saw a return to your normal hair density faster using a device like this, because it's going to bring in those growth factors and whatnot. But is that really a worthwhile investment for you? You know, those extra months of, you know, getting there a few months faster, it seems hard to justify. In my experience treating patients with hair loss, it's so distressing. You're vulnerable, and so, you know, I know it's really distressing, but have a very candid conversation with your dermatologist about like what you could realistically expect from this. Because if you have a form of hair loss that's going to grow back anyways, you know, your future self is going to be annoyed with you that you plunked down all this money. And so have a candid conversation with them. For example, there's another type of hair loss that's really common called alopecia areata. It's an autoimmune hair loss where basically your immune cells attack the hair follicles kind of randomly and all at once, and you get this sudden bald patch. And that regrows in many cases, sometimes it doesn't, but we don't have studies on low-level laser therapy for alopecia areata. So it would be really hard to justify buying something like this with such weak to non-existent data. Strongest for pattern hair loss. How do you know you have pattern hair loss? You see a dermatologist, you get an accurate diagnosis. People with pattern hair loss, it's not unique to men. We've always hear about male pattern baldness, but women have it too. And it really affects women, not only of course in the sense of their hair thinning, but psychologically. Losing your hair, very distressing. Because of the higher levels of circulating androgens in polycystic ovary syndrome, many people with that disease do have pattern hair loss. And this is something to discuss with your treating dermatologist or your endocrinologist if it's worthwhile in addressing your hair loss. All right, so we just got a beep, and I still have more to tell you guys, but one other thing I do not like about this is that it leaves that dent from this little cushion So if that's gonna bother you, know that that happens. It could just be my head is, you know, big, I don't know. I never really considered myself to have a big head. I mean, you're like, all right, egomaniac. No, I'm kidding. So if that's gonna bother you, be aware that it does do that, at least from my head. What else was I gonna say? Yeah, discuss with your dermatologist, your endocrinologist, if low-level laser therapy might be right for you. If you have some of these other forms of hair loss, if you have PCOS and you're dealing with hair loss. Don't forget though, probably your best bet is combination therapies. Combination, maybe in the case of female pattern hair loss, spironolactone. I have a video on spironolactone for hair loss, by the way. Combination of those things along with minoxidil, or aka Rogaine, can really get you even better results. And of course, hair transplant down the road is something to consider, but a low-level laser therapy device can help get you better success and better outcomes from your hair transplant, and is another worthwhile investment in my opinion. I think this device is great, and I highly recommend it for anybody with pattern hair loss, whether they be men or women. It's a safe and effective device. You can expect an improvement in hair density and hair thickness, but not everybody's going to be happy with the results. It's not going to wow everyone. It depends on your background hair loss at baseline and kind of what your expectations are going in. So know that there is a chance that you will not be happy with this. But the good thing about the iRestore device is that you can get your money back after a year, and you're gonna know at 6 to 7 months anyway. But it's great that they take it out to a year. So that's a pretty long time, and that's one of the many reasons why I strongly recommend this device. It's great, and their customer service is really good. Anyways, guys, that's my update on the iRestore. Comment below, those of you who have purchased it, how has it been going for you? Have you seen success with it, or did you return it? I would love to hear your feedback. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.